Hello, everyone, and welcome back to Atlantic Coast Aesthetics. I'm Matt with ACA, and joining us once again is Dr. Thomas Pane, Chief Medical Officer and founder of Atlantic Coast Aesthetics. And Dr. Pane, we have a question of the week here. It comes from our Twitter crowd, and it's about, question is, are there any risk factors involved in laser treatments? And to be more specific, the viewer is asking, they have moles all over their face, and a dermatologist suggested that they go through a fractional CO2 laser treatment. And they're concerned about it because it does affect the face, and they're looking for just some advice and an opinion on this matter. So Dr. Pane, what would you suggest?
Well, that's a good question. There's a couple of points to touch on there. First of all, it's a fractional CO2 laser treatment for moles on the face. We're talking about moles on the face, raised Naevii really is the fancy term for a mole. Laser is not really going to take care of that. They may be talking about age spots or different pigment like melasma or some other kind of pigment, but the multiple over the face. So I think that's reasonable in terms of what we're talking about. And if you're talking about a fractional CO2 laser, that isn't really accurate. Usually you need more than one. What fractional CO2 is CO2 or carbon dioxide laser that we talked about in the past, where it removes the top layer of skin into the dermis in a very precise measured way. The fractional CO2 does that in the same way, but in a limited fashion so that you don't get the downtime of the single CO2 laser treatment. What you're getting is the same energy spread out over a number of treatments, usually about a month apart. There's pros and cons to each approach. In terms of the risk, of course, there's risks to any laser. Risk to fractional CO2 is probably going to be a little less than the full CO2, and that's because you don't get the peeling and scaling. But it's important to realize that in the proper hands, the CO2 laser, the single treatment, is basically just as safe as any other. Where you get into problems is if somebody's doing the laser that doesn't really know what they're doing, and they're giving it too much energy, and you have a problem. So there are risks of that, but in proper hands, very acceptable and small risks. And there was just a recent article about doing a single pass CO2 instead of the Fraxel, which has to be done multiple times. So again, we're seeing things coming in and out of favor. I tend to try to give people the simplest, best treatment that's going to be the least downtime. Sometimes a single pass CO2, when you add up all the downtime of the fractional, is really better. So I'll tell people, think about that. I do this. We don't have problems with complications. It works really well. It does require a little bit more downtime than the fractional CO2, but then you got to do that 5 to 6 times. And you're talking about a treatment time, stretching it out over 5 or 6 months. So just pros and cons to keep in mind when you have the consultation. Risks are small, treatment works, and I think it'll work out, good luck for you.
Well, thank you, Dr. Pane. And if you have a question for the doctor, please reach out to us on our Facebook page or website. And Dr. Pane, we appreciate your time, and we'll see you on the next question.
Great.